Hello, stroke warriors and families everywhere. This is Ralph Cortese again with Stroke Warrior Radio's interviews with providers. Today I'm talking with a leading neurorehabilitation physiotherapist based in, I hope I say this right, Ahmedabad, India.
Yes.
Dr. Margie Pandya, is that right?
Yes. Yes, Ralph. That's right.
Hi, good. I'm glad to have you with us.
Thank you.
As I understand it, you've got a deep passion for holistic recovery. Dr. Pena is known for blending traditional physiotherapy and biophilic approach, connecting nature, body, and mind for deeper healing, which is really interesting to me. So we'll get into that a little bit. You're a senior therapist at Zytus Hospital, correct?
Yes, correct.
And you've worked with hundreds of stroke survivors and TBI, guiding them through crucial early steps of recovery and helping them regain control over their lives. Whether you're newly diagnosed or years into your journey, today's conversation is full of wisdom on every stage. Again, welcome to our broadcast. Glad to have you
Thank you
with
so
us.
much, Ralph. Okay.
Can you tell us a little bit about your background and what drew you into neuro rehab?
Okay, so I have pursued my master's in neurology, physiotherapy in neurology, and it's been 4 years since I'm working with the Zytus Hospital, especially dealing with the neuro patients. I have been a gold medalist in the same field, and so what drew to me this field is really amazing. Like when I was a kid back then, I used to think that there are only three important organs for us to survive. One is the heart, brain, and the kidney. Amongst all, since I was a kid, I really like to have and face the challenging things around me. So amongst them, I feel brain is the most challenging thing you can ever deal with. Whether you are injured, whether you are not injured, but it continuously amazes me with what the wonderful things you can do. Like starting from seeing, experimenting, understanding, and then what comes out. Like if we consider a class of 50 students, although the teacher is one giving them the same education to every student, but only one will be a topper, right? So I feel that this is what, like, everything is maintained by one particular CPU or monitor or a mouse. Everything is your brain. So I was really keen to know and understand how it works and how we can use it in different purposes to gain the maximum utilization of the humankind. So that helped me
Very
to draw into neuro.
very cool. What's your current role at Zytus Hospital?
Okay, so I am a senior physiotherapist at Zytus Hospitals, in which we are supposed to deal with mainly the stroke patients, mainly TBI, stroke, spinal cord injuries, various neurological conditions, starting from the acute care like day zero till the time they go home, and even after that.
It sounds like with your background, your approach has always kind of been in one direction. How's it evolved over time? Can you share any techniques or different principles that you've grown to use
Right.
that
So
you're finding more effective than they used to be?
yes, so when I approached this field, like when I was a newbie to the field, I used to think this as something that is very passive, and with time, you just are stuck to one particular thing. But as I am evolving, as I started learning and loving the subject more and more, I found that no, there is nothing like you are stuck with a thing. You are evolving. Since your brain is evolving, even you are evolving. And that drew me and that made my passion more keen to the subject of helping the people who are more affected. Like if you come across a fracture or a broken bones or a ligament sprain, you do know that you're going to be fine with a certain time, with a certain element, with a certain thing of a do's and don'ts. We have the listed do's and don'ts. But when the patient is suffering from the neuro, there are no such guidelines available. Although the majority of the people suffering from stroke is increasing day by day, but still there is no blueprint. Like, what are we supposed to do? What are we not supposed to do? When will certain things come and when will certain things don't? So it's very important, like with time, firstly, we need to evolve as a physical therapist. Only then we'll be able to evolve the patients and the caregivers, of course. But considering the population and considering whatever the things that are being going on here, it's really difficult for the patients and for physical therapists to give one-to-one attention to the patients. Like if we compare, there are, let's suppose that per therapist there are 10 stroke patients available, if roughly I say. But
Okay.
one to one education is very difficult here because we don't have that much of understanding, and especially the patient is belonging to some rural areas. They have n number of queries with us, like how to deal, how will they be okay, what are the things they should look after, what are the things they should not look after, and how the recovery is going to proceed, what are the techniques they should follow, how they are going to be recover if they are going to recover. So all these things, they keep me driven to the field, and they help me to discover the things which earlier, if I wasn't into the field, I would have ignored.
Cool. What is, I'm curious, very curious about biophilic physiotherapy. What does
Hmm.
that mean and how does it play a role in your treatment philosophy?
Yeah, so biopeel is something that it helps to connect humans with the nature. So in earlier times, we have evolved by living in the forest. Early humans, they used to evolve in the forest, they discovered the fire, they used to eat fruits, plants, even they used to wear leaves as a clothes. So humans have a deep connections with the earth, I would say. Now, if we are supposed to engross the same thing in terms of physiotherapy, bibliophilia is something that you make the patient exercise along with including the nature things. It may be a sunlight, it may be a trail, it may be a walk through the plants, nature, even simple things like growing a plant inside your room or in your surrounding can make a great deal to you. Like we are aware about what the plants and what the nature and what the fresh air can do. Even a simple task like opening a window, allowing the fresh air to come in, allowing us to breathe well, it helps deeply because since we are healing every day, even if we are suffering from stroke or even any of the neurological conditions, we all are healing each day by doing the each things. At the end of the day, we need a healing. So even the simple process like breathing the clean air, redeeming yourself every day, knowing what you are doing, how you are doing, it helps a great deal. Now, if I'm supposed to incorporate the same philosophy into my patients for the neuro, to be precise, I would ask them that, as I told you, just open the windows if you cannot go out or if you don't feel like going out. Just plant. Now that with the technology we have those indoor plants for which you just water it like twice or thrice week, so it's sufficient enough. So the simple gesture like this, like a trail outside, if you just even sit outside the window looking at the balcony, looking at the clouds, it has the reducing your stress, calming, it gives you the calming experience, it helps you to improve the sleep, improve your cognitive functions. So all this, it may appears to be very trivial, but by the end of the day, by the end of the recovery, all these things play a very important role.
I like that. I've always had a fascination with the outdoors, and I never realized that it could be a treatment, actual treatment for you. That's pretty
Yes.
cool. Um,
Yes.
a lot of us up here talk about we didn't know what we didn't know. So for someone who has just experienced a stroke or TBI, what's the first thing that they or their family should understand about recovery?
Okay, so the first thing they should, as a patient or as a caregiver, they understand is that it's not something that's been induced. It's not your fault that you got that. It's not something that could have been induced by someone else's curse, or you are not here because of your old sins or deeds. Number one. Number two, you are here because there would be something which shouldn't have happened, but since it has happened, now we always have to think about what we are supposed to do now, rather than contemplating ourselves about the situations, crying and bragging about what has been done. So instead of suffering, I would entitle them that you need to stop considering yourself as a victim. Number one. Number two, we need to make them understand that this is going to be a long path, a long journey in terms of physical, mental, financial, and emotional turmoil. It's not like one thing like you're going to be well in 15 days. No. It's something that is going to last, and you have to show up with the equal zest that you showed up on the day one. Because if you lost or if the caregivers lost, the half journey is already lost. So the only base part is it's a long journey. That's all.
Wish somebody would have told me that. You know, And that's the best answer I've gotten so far that I've ever asked that question.
Hmm.
How important is early intervention, and what are the signs that someone is working with the right or wrong therapist?
Right. So this is the most important question which I have been dealing with from the patient and from the caregiver side as well. So the signs of the good therapist is someone at first who has a basic knowledge of the field. Like there with the many quacks appearing from here and there, and with the Google, now we have doctors on every corners of the world. But this is not how it is supposed to be, right? So first foremost thing is the education of the therapist. If you think that the therapist who is being excellent in this field, who has been treating these patients, so it's not like they're only going through the textbook. They do have their personal experiences, like the way they deal with the patients, with their problems, and what appears to be a problem or what appears to be some trifle in unimportant things for us, it may be something very big for them. So the problems, understanding the problems, the education, the qualification, then next comes is hearing skills. Now with the development, we are losing the hearing skills because half of the problems of the patients and the caregivers will be solved if we just hear them. If we just hear their own problems, if we just hear what are they going through and what they are asking for us to do, like what are the basic things for me. Let's suppose that it's important for a patient to just run, but maybe for a patient just needs that how he is supposed to turn in the bed, how he is supposed to sit with the minimal support, how he is supposed to eat with the everything that is going on with the affected side, how he's supposed to balance himself. So by just by talking with them, just by having a good conversation with them, all this the basic things like what they are supposed to do, they'll be listing us, they'll be giving us a task, in fact, that we want A, B, and C at first rather than doing C, D, and E. So the foremost thing is you need to hear them. Next comes the empathy. Now the survivor who is there, no one is looking for sympathy these days. No one wants to be feel that they are just a load to the society, that they are a sufferer. So a little empathy, a little communication, then it comes like uh, you need to help them, you need to provide them a safe environment for them to speak, for them to express, rather than just saying and rather than just being ruling the field, that okay, now you are a sufferer, you are not allowed to do this, this, and this. Rather than that, you need to provide them a safe place where they can evolve. Now if I say in India, since the young stroke are increasing day by day, and with the advancement in technology, everyone wants to be dependent, right? So in this era, it's very important for us as a physical therapist to make them feel that no, you won't be dependent on anyone. You are going to soon be okay. You are soon going to rehabilitate and you're going to have your normal life as soon as possible. The urge, rather, the sense of dependency just makes a patient more impatient, is what I see, what I feel. So the foremost thing
Okay,
which I feel, so I think that we need to just make them feel that no, this is just a phase and this too shall pass.
love it. I love it. It took me several years after my stroke before I realized that I could fire my physical therapist. We call him physical therapist here in the
Mhm.
States, um, and go out and seek a new physical therapist on my own. Do you find
Yes.
that what are some of the steps that maybe a survivor should go through selecting a good neurophysical therapist? For example, one of the things I did is I went and visited the facilities to see if they had what the equipment that I might have needed.
Mhm.
What are those kind of steps that you recommend?
Right. So, firstly, I would say that the neurophysical therapist is someone that helps to mobilize. According to me, early mobilization is the key. It doesn't really, once you are fit to mobilize, mobilization may involve you being clear to sit in a wheelchair, you allowed to walk, considering all your vitals are normal, considering you are fit to stand, and since if you don't have any bed sores or any fractures or some any abnormalities which prevents you from mobilizing early, so once you are clear with the fact that you are allowed to mobilize, the first thing according to me, rather any physical therapist should focus upon is the mobilization. Because just by mobilizing a patient, just by making him sit on a wheelchair or just by making him stand, almost you have solved 90% of their problems, because even this particular little thing will help them to get rid of all the tubes, all the drains they have, all the post immobilization effects, whatever we have, like dealing with the bed sores, dealing with some infections, dealing with some deformities, dealing with the breathing issues, almost that kind of the problems we'll be solving. So the foremost thing is mobilize with support, without support, with maximal support, even if it is going passive, just mobilize. And if I feel the physiotherapist is achieving this important task, then almost the patient and the caregivers and even the physical therapist has won half the battle.
What advice would you give caregivers during the early stage of recovery and adjustment?
Uh, well, I would ask the caregivers to firstly treat stroke patients as a patient, rather any patient as a patient, because this is the foremost thing which is going to make them impatient. Rather, you just treat them as normal as you can. Like, I have an instances where the patients, rather the caregivers, they are being parents at the age of maybe the patient is somewhere 72, 75, but they tend to treat them as some fragile kids. But they don't want that. They want them to understand the situation. They want them to give them a chance. Because I, as a physical therapist, say all of my patients that you are supposed to use whatever the movements we have gained. If you don't use it, you are going to lose it. The simple neuroplasticity principle that we are already aware now. But the caregivers do have a tendency, because even they are scared that if they are going to allow A, B, and C to the patient, they might hurt themselves, they might fall, they might damage themselves in any way, rather physically or mentally. If the patient is unable to do certain tasks, they think that again that particular patient might tend to go in the depression. They again will be in a emotional turmoil, rotating and revolving himself through the unending, wavering thoughts, which any caregiver would probably don't want. But the thing is, in the midst of doing all these things, you are demotivating and you are degrading your own patient, which is something that needs to be stopped upon. You need to provide them a safe space. I agree. You need to provide them the safety measures, but you need to stop being a hindrance to that. So I feel that they have to be cautious. They have to be safe, but not at the cost of just making a patient stick to the bed or the chair.
Have you found that the care partners that are helicopter care partners are worse for the patient than the ones that back off? I mean, I've seen survivors that the care partner does everything for them.
Yes,
That's
yes.
that's going to slow down the progression of the recovery,
Agreed. They
you know.
provide them almost a bed, rather a home around their own bed, like starting
Yeah.
from the basic activities like brushing, combing the hair, making them wear trousers, helping with their medicines. Everything is done by the caregivers. But if that is already to be done by a caregiver, I think that there is no need for a patient, rather a caregiver, to pay a physical therapist if you are supposed to do all these things for yourself. But
Yeah,
if you
that's
want,
there's no incentive.
yes, so if that needs to be stopped upon, then patient has to do a movement, because ultimately movement is medicine.
The mental health and expectations, or the expectations we have in the beginning and the lack of information a lot of us do get in the beginning, causes a lot of survivors to struggle with plateaus or being stuck. What would you say to someone in that phase?
Well, since we had a talk in the early stage, brain is something that is constantly evolving. So if your brain is evolving, it also means that your movement will. So I don't think that there's something called as a plateau or the golden time period or the initial 6 month phase. Earlier, no doubt, we had a myth about the golden time and the early recovery phase that only lasts for about 6 months. But now, with the advancement in the technology, there have been evidences which suggest that the neuroplasticity does continues for years together. So there is nothing like hitting a wall or reaching a plateau. As long as you're moving, as long as you're trying, practicing, you'll be constantly evolving and you'll be constantly getting and sailing through the recovery path.
I, I'll tell you, I'm not bragging, but I am. After 6.5 years with
Mm-hmm.
very stagnant recovery. I got off my cane, AFO, and walker, so I don't use any of that anymore. So it
Okay.
can happen.
Okay, just sorry to break you out, but what do you have any impairments? Like if some other patients who are not very aware about you being a survivor, does they perceive you as a survivor now?
Yeah, and to me, we joke about it, but it's not really a joke. You can make the choice of being a stroke survivor or a stroke warrior. It's your own choice.
Right.
How do you help clients set realistic goals, but still be hopeful in their recovery?
Well, I think that you need to try because the hardest battle is the one that you fight in your head. If you think you are done, you are done. But if you think you still have a hope, you still can do well, then obviously you can. So I think there is some saying that say you are harder than you believe and smarter than you think, I guess. If I'm not wrong, please correct me. So
I've
I
heard that.
think this is what holds true in this field as well. The moment you think you have done yourself is the moment you have lost the battle. So first battle I feel it starts all in our head. You need to stop thinking that this is it. You need to feel that you are going to be okay, which ultimately, considering you, as all of us can see, you have rehabilitated yourself very well. Because ultimately, all of us are trying to do is rehabilitate to again go back to the path that you came from and start your normal journey as soon as possible. So there is nothing like it's done, we have to stop. You have just stuck a hole or you're just stuck with a wall. Recovery is something that keeps on for years, although the pace will be slow, but yes, it stays for years.
Small victories add up to big ones, don't they?
Yes.
Are there any surprising breakthroughs or moments of hope you've seen that stand out in your career?
So yes, during my early days, I used to think that majority of the people they give up. Like people, once they start walking, they feel they start considering hand as something that is not important. In the earlier, like before the stroke phase, the hand, which served to be the most important tool for any of a normal human being, suddenly after suffering from after the stroke, people think that okay, a hand is something a useless thing. They don't use it. They just have a tendency of keeping the hand in one particular position. If many of us have come through, they keep in this position. The typical stroke positions is what we see nowadays. But the thing is, there was one instances when after like I see a patient, he is a stroke survivor, and I'm treating him since last 1.5 year. And now after so long, I do have this moment in which he can open his fingers, keep the wrist up and down, and do little bit of typing and playing a piano. So this was something a breakthrough, like, or this was something a wow moment I came across few days back. So this is something I felt that no, okay, whatever I'm doing is something important to the field, rather I'm going in the right direction. Because as a physical therapist, even at times we feel that okay, whatever we are doing is not helping the patient. We as a person feel that okay, we are unable to help them even after doing all these things, even after knowing and aggregating and helping them with all the evidences we have so far, it's not helping. Like we are good for nothing, and we start doubting our own capabilities. But then again, precision, consistency, and hard work pays in the end. So this was something that I achieved a few days back.
Let's talk about people like me that are, I'm 9.5 years post-stroke or long-term survivors. Uh, what advice would you give or offer survivors who are several years post-stroke but still want to improve and haven't because of lack of education, lack of better treatment, lack of insurance, whatever?
Right. So I think that firstly there needs to be counsel well. That as I told that they need to stop feel that this is it. They need to know that with the recent advances, with the recent discoveries, we are evolving day by day. They need to use or they need to use some of the assistive devices to make their life little bit easy. For example, if someone is engrossed in a field with the IT or someone is working with the computers, now with the advancement of the technology, we do have the specialized keyboard that can be used with one hand. with some compact devices, and we use it on the sides and on the precise postures what we are supposed to adapt. Then some of the modifications that we can do along with, like how a shoe has to be worn, how the specialized spoons, specialized handles, some changes in the grooming as well. So I think if we just work on certain things, we can actually help them to rehabilitate. And for the long term patients, I feel the basic thing which they want to do is to at least help, to at least be independent with their ADLs, the activities of the daily living. They want to stop feel that they are dependent or they need some plus one support. So there is nothing like, I would say, that you need to stop. You need to you need to work day by day, just for the improvement's sake. And maybe one day you are going to be normal soon. So this is what I feel. And if not, and if your physical therapist, if your caregivers is unable to give you that, I think you need to change the one and seek the second opinion.
There's those little victories that reignite the fire to want to recover and become
Yes.
better.
Yep.
Um, do you recommend continued therapy even after someone regains mobility? What kind?
Yes, I think that we need to continue it because, see, once you suffer a brain injury, a brain has undergone a ample amount of a stress. Many of the neurons or the brain cells would have died, and now to gain them back to the state, we need to work hard, of course. So I feel it's a myth rather that once who was a gym trainer or once who is engrossed with the heavy activities won't be getting a stroke is just going to be fine forever. But this is not it. Your physical abilities, since for even for a stroke patients, if I would say, just the normal task like lifting up a mobile phone is going to be a great deal, is maybe an equivalent to climbing a Mount Everest at times. So once even you have gained the mobility, since you are spending lots and lots of energy in choosing or in doing a simple task like lifting up your phone, that endurance, the endurance which you had in your pre-stroke stage, needs to be recovered. So yes, even I would say we can decrease the intensity or we can decrease the amount of the sessions, but yes, physical therapy, rather activity in any of the field will be highly appreciated.
Do you suggest that people, this is something I did and it worked for me, but do you suggest people that have lost the ability to do something, do it anyway so they relearn how to do it?
Well, I would say in the initial phase, we do recommend the patient because ultimately we want them to move their hands in their legs. It doesn't really matter how they are moving. What matters for us is they are moving. So initially, we do allow them the trick movements or the wrong and the faulty movements. But once they have learned, now we don't want them to master it. So we have to correct them, because if you don't use it in a way it was designed to use, you are going to add the another abnormalities for yourself, like maybe a shoulder pain, back pain, knee pain, which ultimately is going to keep you confined to a bed once again. Now, not with the stroke, but with the other abnormalities which have been added maybe because of the stroke. So I feel that we need to master the normal movements once we have gained bit of a strict movement.
Great. Great. Couple quick question, several more quick questions for you, and with
Okay.
some quick answers that are curious to me. Morning or evening sessions, when is rehab most effective?
I feel morning because patient and therapist both are charged.
I like it. Nature walks or gym therapy? What's your personal favorite form of movement?
Nature walks,
I
always.
like the air, the sun. Yeah. Books or
Yes.
podcasts? Where do you get your inspiration?
Well, my answer will slightly be biased because of this, because I am a bookworm, to be put it in a word. So yes, books.
Okay. Manual therapy or electrical stimulation? Which one do you reach for first?
Always a manual, because manual is something that can also be practiced in the areas where you don't have the facilities of some highly equipped devices. So no one can beat the manual first.
One tool or technique every survivor should know about.
Uh, breathing techniques, I say breathing techniques, relaxation techniques, the way you're supposed to transfer mobile, the way you're supposed to at least transfer yourself from the bed to the sitting position, and if you're in the sitting position to the wheelchair, or maybe probably a standing.
Oh, I like that. One thing you wish all caregivers would do more of.
Mm, to stop making a patient feel a patient.
Okay. Simply put, I love it. A therapy myth you'd love to bust once and for all.
Mm, recovery is something that stays with you forever, till the last breath.
Your go-to wellness practice at the end of a long day.
Mm, talking to my parents, having dinner with them, and confronting myself if I have helped enough with the patients and myself. The sense of
Recovery is,
satisfaction.
yeah, there you go. Recovery is,
Never ending.
I like it. What one message would you wish every stroke or TBI survivor could hear today that we haven't covered?
You are stronger than you think and smarter than you believe.
I love that phrase. I really do. What do you think the future of neuro rehab looks like, and how can survivors stay informed about the evolving healthcare options?
Well, the future of neuro rehabilitation looks like that now with the evolved technologies, we are just trying to eliminate whatever the deformities that was presently being seen almost in all the patients. So the more with the use of more robotics, with the more use of the more specialized devices, splints, more of the stimulations therapy, we are now gaining a control on how to make or how to reduce the trick movement to avoid whatever the additional things we get as buy one get one free. So with this, we are trying to overcome the things which were not possible earlier. And now that we are seeing and with the evidences, we do have what we are supposed to do, and most importantly, what we are not supposed to do in the early phase. And as far as the new innovations are concerned, I feel that whatever the innovations you can deal with, I mean, you need to go with the manuals. The basic thing which can you can do is the manual, because ultimately it is suppose you are supposed to rehabilitate. In order to rehabilitate, you will be needing all sort of a movements starting from holding, gripping, balancing, using your washroom, getting up from the bed. All these things, if with the assistive devices, it's useful, yes, but if not, then you need to go with the book thing, the years together which we used to follow back in the gold bed times. As far as innovations is concerned, I feel that the constant evolving we are now that with the feel that we as mobile is easily available to us, the what best thing we can do is just scroll. Once you scroll, and with the smartest technology we do have access to our secret microphone. So if you just speak around the phones once or two times, I'm looking for the devices, I'm looking for the help, I'm looking for something neuro, the mobile or the Instagram or the Google is going to show any number of innovations to you. You just need to speak, not even type.
Okay. How do we get a hold of you to hear more about your work or connect with you? I mean, you're on social medias, right?
Yes, I am. So,
What's
and
your
I'm
Inst
available on Instagram at Margie Pandya on Instagram, and I'm available on LinkedIn as well with the title of Dr. Margie Pandya.
and you're at Zytus Hospital, Ahmedabad,
Ahmedabad, yes,
Ahmedabad.
Gujarat, India.
Okay, I love it. If you're a stroke or TBI, thank you so much for your time today. I appreciate it. If you're a stroke or TBI survivor or caregiver looking for guidance and community, you're not alone. Stay tuned to Stroke Warrior Radio for more inspiring voices like Dr. Panda from front lines of recovery. Have a great day.
Wishing you the same. Good night for me and good morning for you.
Yes, we'll talk to
Okay,
you soon. Talk again.
Def- definitely. Bye bye.
Bye.